Welcome to our city, and here's what's going on this week around our city. On Wednesday, September 27th at 6 p.m., Mayor Bowles will join EDC, the Elizabeth Development Company, as they host a neighborhood leaders reception and commemorate their 40 years of service here for the city of Elizabeth. This celebration will take place at Dolce Restaurant, which is located at 17 Broad Street. For more information, contact EDC at 908-289-0262. If you need more information concerning this event or any other events, please contact the Public Information Office at 908-820-4124. And we'll be back after these words with this week's segment. Thank you.
Offering everything you could want from college, including a life. Kane University.
Welcome back to our city, and this week we're talking about Breast Cancer Awareness Month. And joining me are three wonderful doctors from Trinitas. I'm going to let each one of you introduce yourself and tell us a little bit about yourself. We'll start with you.
Hi, I'm Dr. Nancy DiLiegro. I'm the Chief Clinical Officer, Vice President of Clinical Ops and Physician Services at Trinitas Regional Medical Center.
Welcome.
And I'm Dr. Suarez. I'm the breast surgeon at Trinitas Regional Medical Center. I work in the Cancer Center, treating patients with breast cancer and also benign breast disease.
Welcome.
And my name is Dr. Cholankeril. I'm a medical oncologist at the Trinitas Cancer Center, and I too have been trained in both medical oncology as well as hematology. I treat breast cancer and other solid and liquid tumors.
Welcome all three of you.
Thank you.
I've been teasing you off camera, so it's going to be a fun half hour talking with you. So welcome to the show, all three, and let's start with Nancy and talk about why was Paint the Town Pink initiative, why was it created?
Paint the Town Pink was created as a brainstorm of mine to increase awareness about breast health. And I say breast health because everyone is looking at October as Breast Cancer Awareness Month, and I'd like to see it as more increasing awareness for women to do their annual screenings, be aware, be educated, and have a better sense of their risk assessment and to do self-exams. So we're partnering with the City of Elizabeth, we're partnering with the Elizabeth Board of Health, Susan G. Coleman of Northern New Jersey, Proceed of Elizabeth, Elizabeth Avenue Partnership, the Greater Chamber of Elizabeth, and Bloomingdale's of Short Hills. And this is mainly to increase awareness and to work with businesses and homes in the community to put pink ribbons outside to show that everybody that we're working toward a movement for local, national, and regional.
Okay, thank you. And I'm going to go to Dr. Suarez next, and we're going to talk about some of the events geared towards the Latino population for the month of October. Dr. Suarez?
So I'll be doing an event with our breast cancer navigator at Trinitas called Tu Futuro en Tus Manos. It'll take place at Proceed Inc. in Elizabeth on October 13th. It'll be a great event also to increase awareness and education on breast health and breast cancer.
Okay. And Dr. Michelle, last but not least, what does Trinitas offer their own breast cancer patients?
So that's a great question. Every year we actually have an event at the Cancer Center in October for our breast cancer patients and survivors. And essentially we have entertainment, food, music. This year we'll be having members of the New York Symphony Orchestra there for entertainment purposes. Also, every year we have a Survivors Day for all of our patients with breast cancer and other malignancies, just to celebrate their treatment, diagnosis, and their survivorship pathway.
So, how can women take control of their breast health? Nancy?
How they can take control is to be privy to the educational forums that are out there in the community. And what they can do is attend our event on October 10th, which is Paint the Town Pink, as well as share a pink evening, and we're hosting that in conjunction with Bloomingdale's, and it'll be evening of discussion and education with an expert panel of our physicians, a panel of female physicians, if I may get that in, and learn about what they can do to take care of their breast health.
As we talk about breast cancer, to find out early stages, that's the best thing to happen, am I correct? How do we encourage women to do that?
One is to do self-exams, starting at a young age. Two would be to have annual screening mammographies and to be aware of their risk category. And for the protocols and criteria that need to be followed of when a woman should be getting a mammography, I would defer to Dr. Suarez for that.
Yeah, I mean, there have been, over the course of a few years, a lot of different protocols or suggestions or guidelines that have been published. And so I think it gets very confusing for women, even for primary care physicians to follow. But I think the most recent, released in 2015 from the American Cancer Society, suggesting that women over the age of 45 who are at average risk. So this is a woman with no family history of breast cancer, no previous history of any cancers, no genetic mutations that would put her at a higher risk for breast cancer. So those average risk women should start yearly screening mammography at the age of 45. Women between the ages of 40 and then 44, that's where you have to have an informed discussion with your primary care physician or with the breast health specialist to really discuss the pros and the cons of getting a screening mammography at that age. But certainly that is our most common method of detecting cancers at the earliest stages when it's curable, and very important to be educated about.
Can someone take or give themselves an examination at home or wherever?
Certainly body awareness is important, so doing a self-breast exam, as Nancy suggested, is very important, and that can be done on a monthly basis by yourself and know what changes are coming about your body and then present them to your primary care physician.
And if someone thought they had discovered a lump, what's the best thing to do?
Seek your care from your primary care physician immediately.
Okay. Dr. Suarez, what changes will we be seeing at Trinitas Hospital in the upcoming months, and how will they affect breast health?
Very big, very exciting changes. We have the Connie Dwyer Breast Center is currently being built. It's going to be a beautiful center for women to get their mammograms and do all of their breast care in one place, in very nice, calm, private setting. And it will be right next to the cancer center, so that multidisciplinary team that's necessary when there's a diagnosis of cancer will be right there, very accessible. It's very exciting for us.
And Dr. Michelle, what is a breast cancer navigator, and how does that affect our breast cancer care plan?
Sure. So basically receiving a diagnosis of breast cancer is always overwhelming for anyone, as we can imagine, and then to actually tackle the healthcare system after you receive that diagnosis can be very daunting. And at Trinitas Cancer Center, we actually have a position of breast cancer navigator. Her name is Veronica. She's bilingual, she's nationally certified, and she actually meets patients upon diagnosis, helps them navigate our system by getting mammograms and proper imaging in a timely manner. She assists them by making sure that she sees doctors that are beneficial in her care to come up with the correct treatment algorithm in a timely manner once again. And of course, she also offers them emotional, financial, and social support for a lot of our women with the help of our social worker, physical therapist, and the other services that we provide at the Cancer Center.
In addition to helping the patient, is there treatment for the family as a whole?
Mm-hmm. We actually, interestingly enough, have a caregiver support system. We actually have monthly meetings for caregivers, and our social worker is really good about reaching out to patients, their families, seniors, and the children involved in this whole process, because it truly is a family issue once a patient has a diagnosis of cancer.
As we talk about breast cancer, the first thing that comes to mind is women, but men can also have breast cancer, am I correct?
Correct.
Absolutely.
And what's the treatment for a man?
It's the same as that for a woman. So certainly men should be aware. So while only 1% of breast cancer cases occur in men, it's actually a large number. I would say about, I'm going to get this wrong, but 40 to 50,000 men a year. So it's still large. I just said that.
That's right. 42,000 men
Yeah, it's a lot of men that are affected by breast cancer. So it's very important for them as well to note any changes in their own physical exam at home and present them to their primary care provider. Absolutely.
Yeah, and just to add to that, it's, we screen males with mammograms. They also get ultrasounds just like women do. The treatment, even after receiving the diagnosis of breast cancer, is the same. We offer surgery, chemotherapy, radiation, and oral pills and anti-hormone therapy, just like we do for our females.
In addition to the mammogram and ultrasound, are there other ways of someone to be checked or diagnosed? Or is that it? Or
I would say probably the clinical, a patient's own physical exam, a primary care, and a mammogram is at least the basic screening tools that we have currently.
And stress, or is there food? Is there something that's linked to breast cancer, or no? Which one?
I think there's a whole host of issues.
Okay.
I think there's genetic. I think there's environmental. I think thanks to technology, I think we're learning more about this, and I think we're seeing that the prevalence of breast cancer, the incidence is increasing, and we wonder if there's something environmental involved. But we do know genetics does play a role in breast cancer health as well. So knowing your family history is very important, especially when we talk about screening guidelines in high-risk patients.
And someone's high risk, and you know your mother or someone else in your family had it, you definitely should come in right away for a checkup.
Especially if you feel something has changed, absolutely.
And how do you go out and encourage someone to do so? I mean, people say, I feel fine. So what do you do for that person?
Educate
Yeah,
and make
education.
aware. I think if I could elaborate a little bit more on what Dr. Cholankeril said, there are risk factors for breast cancer that you can't change. Things like your age. We all get older. We can't change that. Family history, things you cannot change. Your genetics, you can't change. Those are things you're born with. But then there are modifiable risk factors, things you can take some control over. And it doesn't mean you won't get breast cancer if you take control of them, but certainly you can lower your risk. And those are things like maintaining a healthy lifestyle, keeping your BMI low, exercising, keeping your alcohol intake low, not smoking. Those are very important to lowering your risk for future breast cancer development and taking care of your overall health.
And Dr. Nancy, as we've been talking about Pink, the Town Pink initiative, how can individuals participate in this initiative?
They can respond. We have a number that they can call in, 908-994-5836, and RSVP. We can have a capacity of at least 100 women or men attending the event at Bloomingdale's, and the more the merrier, because the more women we reach out to, the more the message gets out there.
And if an organization wanted a doctor to come out and talk to them, is someone available sometimes, or is that possible?
Absolutely.
Always.
Yes.
And what's the best number for someone to contact for that?
Well, you can always call my office, 908-994-8230. And if we're not in the office, I have an answering service that reaches me 24/7.
Right. And we've probably talked about this already, Dr. Nancy, but to come back one more time, how can a woman actually take care of their breast health?
One, I would say that teach them at a young age to, one, I mentioned, do breast self-exams, which is key. And if you know that there's a history, to make sure that you work with your primary care doctor, who would work with you, and I refer to the doctors on this, in terms of getting genetic testing done. We do it at Trinitas, and it's key for those women who are at high risk to assess what they need to do and how they are at that point in time, meaning at what age. And education, and the more that they increase awareness and the more that we get the message out there into our community is key, and that's what we're really pushing for in this movement in the month of October, which is Breast Cancer Awareness Month.
Okay. Now I noticed 3 of us are wearing pink, and one person fell off on the pink memo. What happened down there?
I was just thinking about that this morning. I was thinking it's in the spectrum of pink.
It's in the palette.
It's the bright
in the,
pink.
Right.
It's the fuchsias. Sorry, that's
Your buddies here are taking
See?
good care of you.
Yeah. Women stick together.
Okay, on that note, Dr. Suarez, what is the role of a breast surgeon at the cancer center?
Well, I think it's scary to hear breast surgeon because I don't operate on everyone that comes through my door. In fact, I would say the grand majority of patients that come to me, they are there to assess their risk because they're concerned, they have a question, and that's what I am committed to doing, is providing information about breast health and breast cancer. I'm fellowship trained in breast surgical oncology, but also in the breadth of breast problems that can arise in a woman from young age to old age. So that's more my role. And in the breast cancer realm, I work with the multidisciplinary team of medical oncologists, radiation oncologists, pathologists that are specialized in breast cancer as well, the breast imagers in our hospital, the social worker, the breast cancer navigator. So it's one part in a large whole that I play.
And Dr. Michelle, are there any new interesting options on the horizon for breast cancer regarding medical oncology?
Sure. I think the exciting thing about medical oncology is that there's always something new on the horizon. I think in the past few years we see that oncology, we're focusing more on personalized medicine. Just as two people are not the same, we see now that two breast cancers are just not the same. And we're trying to find at a molecular level, how can we save a patient's life and prevent the recurrence of cancer? So technology is interesting. The last few years we've seen at the American Society of Clinical Oncology that we're talking more about maybe we'll have breast cancer patients not so much only be diagnosed with the cancer, but figure out what is the reason that they had the cancer. Is there a mutation involved? And do we have a medication out there in the market or in a clinical trial that where we can prevent that mutation from occurring, kill actual cancer cells, and prevent it from coming back? I think immune therapy is an exciting topic that's also out on the horizon, which we've heard about in many other malignancies, and we're seeing it in clinical trials with breast cancer as well. I think it's going to be exciting. We don't actually call this chemotherapy. We see that in cancer therapy that some cancers actually occur because our immune systems are hyper-responding to an event. And immune therapy, what it essentially does is it prevents the immune system from hyperreacting and tries to actually shut the immune system down and kill the cancer, essentially. So I think that's going to be exciting in breast cancer health, and that's really going to change the future of it.
Okay. We're going to take a break and we'll be back, okay? We'll be back with the second half of Our City after these words. Thank you.
We're an American original, dependable, historic, nuanced, with all the comforts of home, even when you're just visiting. So we're celebrating for all that we've left untouched and all that we've changed. A place where the past meets the future. So consider this your invitation.
We've been celebrating here in Elizabeth for 350 years, and we're just getting started.
Welcome back to Our City. In this segment, we're talking about breast cancer awareness. And we talked about an event earlier called Paint the Town Pink Initiative. And we're going to go back to that for a second and just talk about Share a Pink Evening. Elaborate on that a little bit more. What's going on there?
Share a Pink Evening is being sponsored by Bloomingdale's and Short Hills. And at that event, we'll be having the two doctors to my left as speakers, as well as several other female physicians speaking and expressing their expert experience and knowledge base in various areas of breast health. Not only a medical oncologist, a breast surgeon, we have a mammographer who is a radiologist who reads the mammographies. We have a pathologist who reads the biopsies. Who am I leaving out?
Radiation oncologist.
Radiation oncologist who does the treatment with radiation. So we're having all sectors of the treatment, from screening to diagnosis to treatment to maybe surgery, follow-up, and it'll be from the beginning to the last step of their treatment. And the doctors here will be speaking as well, and might want to share some of the points that they'll be discussing at the program.
Well, I think what's really important about that night is it's really informal. I mean, women can come in, it's from 6 to 9. You come in, you have something to eat, a drink, and we could just be very informal.
How does someone register for the evening?
908-994-5836.
So you have to be register in advance?
Yes.
Okay.
I mean, granted, if someone shows up and they say, I forgot to RSVP, we're not going to turn them away.
Okay.
It's a little shopping, a little nibbles and information. So if you really have a question that you don't want to wait for the appointment with your primary care physician, we're there, so we'll answer any questions from people that are really enjoying a night out as well. So it's a night out, but with information provided.
So in the event someone is diagnosed with breast cancer, and then down the road we say, oh, they're healed, they're fine, do they have to come back and continues to be monitored? How does that work?
Great question.
That's great. So usually after breast cancer patients are done with the treatment, we actually like to bring them into what we call the survivorship track. So there we will always have continuity with them. After they're done with their treatment, we actually have a survivorship program where we place patients in and watch them and monitor them for the next few years. And we also try to reassure them that they do have to continue to see their primary care physician and remember to reestablish that relationship with them. We actually see them every 3 to 4 months after they're done with their treatment for patients for 5 to 10 years after, because usually breast cancer, if it unfortunately does recur, we are looking at the first 5 years after treatment is complete for any type of recurrence. And then of course we do our annual mammographies that will not end. And I think we have pretty good follow-up with our patients. We try to get them back. We were talking earlier about modifiable risk factors. We try to make sure that we have them back on a great exercise pathway, a good nutritional pathway, that they make sure they're being screened for other cancers, because breast cancer patients are more likely to actually have a second malignancy in their lifetime, greater than the average individual. So we make sure that they're up to date with their pap smears and their colonoscopies, make sure that they're taking care of their cardiovascular health as well, because unfortunately some of the treatments that we do, though they are excellent and novel, they do have side effects and long-term effects.
We do have programs for those women who cannot afford to get a mammography, and we do that through the Susan G. Komen grant that Trinitas has, as well as the NJ Seed program, which is the New Jersey Cancer Education and Early Detection program. So we do capture a lot of women through those programs and make it available to them, as well as provide education.
Okay. And when we talk about clinical trials, what's some of the latest with that?
So we actually offer our patients a number of breast cancer clinical trials, and at different stages. We have a few trials that we're actually partnered up with Thomas Jefferson in Philadelphia, which is a great cancer center. And we actually have a few trials for patients that have actually received their surgery. Some patients that are hormone responsive, we have options for them. And then we have options for those patients that are hormone negative as well. We have also clinical trials for patients that have metastatic or late stage disease, where we actually offer them oral pills to take at home in the comforts of their home with their family, instead of coming back and forth for intravenous chemotherapy, which is really great for some of our patients. With a lot of medications that have been making headlines and have new FDA guidelines in the past 2 years. So we actually offer those type of clinical trials. I think some of our more exciting clinical trials are also the ones for our survivors, the ones that feel like after chemotherapy, they want to get back into the fitness track and prevent obesity. We actually have a trial called the Be Well Fitness trial, which actually incorporates a nutritionist, a physical therapist, and even a Fitbit. And we actually monitor their weight and their steps that they take and try to get them to a good plan over a 2-year period. We also have 2 clinical trials with Kessler Rehab, which is a nationally renowned physical therapy program in the United States. And they actually offer 2 trials for patients that have received chemotherapy that either feel very weak from the side effects of chemotherapy and want to see if they can get back to their baseline. And we actually offer another called Chemo Brain study for those patients that feel that they had some cognitive impairment from the effects of chemotherapy, to see if there could be any change in their cognitive well-being in the next few years.
So is there, I don't know if you know the answer to this, but is there a support group that someone can go to?
There's so many support groups out there. That's a great. So our social worker actually has we have multiple support groups within our cancer center. We actually have one that's just for our breast cancer patients that occurs once a month. We have one for both Spanish-speaking patients as well as English-speaking patients. We also have one for caregivers, and we also have other support systems for patients that don't even have breast cancer but other malignancies as well. And actually the city of Elizabeth and a lot of the associations in the county actually offer support groups in nearby areas as well.
So it's important that not just during breast cancer month, but throughout the year you get the word out. Once again, what's some of the events happening for the month of October?
So we do, as we've said, the Share the Pink evening, but also Tu Futuro en Tus Manos, which is geared more towards our Latino population, and it will be hosted by Proceed, but by me, the breast surgeon at Trinitas, and also the breast cancer navigator, Veronica Vasquez. We're both bilingual, and there's a great majority of my patients that are Spanish speaking, so this will be a great opportunity to share similar information that we're sharing at the Share the Pink evening in Spanish. So a very similar evening with food and drink, and I'll be talking about breast health, screening, risk reduction, diagnosis, treatment, and also open to any questions that these people have.
So last year we had a celebration for the month of October, and it was predominantly women. Let's say it was 249 women and one man, and everyone thought he was just there as a husband. But at the end, they asked anyone who was in recovery to stand up. And he walked up and he said he was a little embarrassed, but he wanted everyone to know that as a man, it can happen. How are men taking it? Are they saying, oh, no, not me, it's only for women? What happens there? What's going on?
I think men, exactly what you said, don't come in because of that. I mean, men don't even acknowledge that they have breasts, that they have breast tissue, that they could develop breast cancer. So of course it's an embarrassment if they were to come in, but it shouldn't be, because it's a disease that doesn't, yes, it predominantly affects women, but it doesn't see gender, it doesn't see race, so it affects all of us. And we all have to be body aware and self-aware and be able to present early enough that we could treat this. It is curable and has a great, I mean, why we're talking about survivorship issues is because breast cancer is survivable. You could live your entire life having survived breast cancer. And so it's very important to catch it early so you can live that long life and live through that.
And at the end of the event, everyone came up, I was 16 years survivor, I was 20 years, and those who were going through early stages had hope now, and they were like, it's not over, whatever the case may be. Are there any medicines you see, new medicines coming around, or?
So many. So many. Every day oncology is changing, and it's so exciting because, I think even though treatment was great 30, 40 years ago, we had few options. They were good options, but I think now in the era where we understand breast cancer and the biology of the disease and understand that no two breast cancers are the same, I think we're seeing new treatment options for patients and options that patients can actually live through. They don't have to get chemotherapy all the time. They don't have to be attached to a pump all the time. That stigma that comes along with getting therapy for breast cancer. A lot of our patients take pills every day, whether they're early stage cancer or maybe more advanced stages of cancer. Our patients with stage 4 disease are living so much longer than they used to. We can't say that about a lot of cancers. We have some breast cancer patients with stage 4 disease that are living 8 and 10 years that just are maintained with 1 injection a month, 1 pill a day, and they're doing excellent. So I think technology is great because it reduces the side effects of the therapy. It is making helping our women live longer and staying healthy, and it will be exciting to see what else is on the horizon.
Okay. And before we wrap, I just want to get some more information on Share a Pink Evening. If someone wanted to sign up with some more information, what's the best number to call, or if there's a website or anything?
908-994-5836. And we
Anyone
hope to
ask
see
for?
you there.
Yes, for anyone, or just?
There'll be someone there who'll be answering the phone, or you'll leave a message.
And the date again for Share a Pink?
October 10th.
Okay. Thank you very much, doctors, and much continued success in your work.
Thank you.
Thank
And it was
you.
nice talking with you.
Thank you.
My
Same
pleasure.
here.
Thank you for joining us for this segment of Our City. Have a safe and wonderful week. Thank you.
Sometimes you learn by helping others learn. Kane University.